So what systemic changes do you believe are essential to achieving equitable maternal and reproductive health outcomes?
I have a few, but first, free universal health care. I feel like everyone can agree on that. Eliminating that financial barrier that people have, especially when it comes to birthing babies. It's a 70K bill, and no one I know can afford that. In that same vein, having expanded access and having awareness on healthcare options. So meaning we need more clinics, we need more OBs, we need more OBs that look like us. We need to have more conversations about fertility. What is IVF? What does that look like for you? What is abortion? What type of abortions? There needs to be more expansive healthcare options and awareness on them. Um, Another thing, I love talking about sexual education, but we need to rethink curricula when it comes to schools. Um, we need to be talking about the things that we don't want to talk about, STIs, and the community involvement in that. Parents need to be talking to their kids. It doesn't just happen at school. Um, Another thing, policy development. We need to have policies that advocate for reproductive health. We need to have communities at the table talking about these policies. Um, and last thing is holistic reproductive health care. Um, so instead of just thinking about STIs, abortion, and pregnancy, we need to be thinking about the whole reproductive life cycle. So, including males, what goes on with males within reproductive health, but also our aging population gets left out a lot. Um, Menopause is a thing, and it kind of falls by the wayside, which I really hate. I would love for us as a society to move into a reproductive justice framework to address social determinants of health and mobilizing our communities for systemic change and really thinking about the intersectionality between reproductive health and us living our daily lives.
Love that and appreciate that. And there's a lot of great information in there that I definitely think people that are interested in this reproductive justice and maternal health can really see where they can fit themselves into that. Because in all those things you say in there are ways that you can get involved with your public health background and really find solutions and create system changes that are so important. And as you said, like universal basic healthcare, universal healthcare is something that we talk about so much, and I think it just allows so much equity to that is not already in the system. It creates more of that equity and creates a space. And I've been hearing this a lot more in the reproductive health conversations, is like men's health and how men's health plays into the woman or the birthing person's health and the baby's health. And I think
Yes.
that's something that I haven't heard before, but I think it's something that's important to have this conversation, that it's not just the person that's carrying the baby, but the
Mhm.
other partner also plays a part in it. And how do we create, and I think like that's the thing in public health, is like, how do we create a family structure that's strong and healthy that can
Yes.
create just healthy outcomes.
Yes. 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 Plus one to everything.
Love it, love it. Okay, so shifting a little bit here. Before we get into more of your collegiate journey and how you got to where you got to, would love to hear, what does public health mean to you?
Uh, I love public health. Um, Public health is all about the well-being of community. I love community. It is about protecting and improving the health of those we live, work, and play with. As a public health professional, I don't think of myself as being adjacent to community, but I'm truly within community. I work in my community. I live in my community. Um, every time I step out the house, I think about my community. And I think when it comes to public health, it's more than just, oh, you got sick. It's more than just numbers. It's that community aspect. It's knowing your community, is being within it. It's working with community members. And that's what public health means to me.
Love that. And how did you come to the perspective of I'm embedded in my community? I love community. Community is so important to the work that I want to do.
I've always been a community person. I come from a background of doctors and teachers. So my grandmother was really a big pivotal point in my life of being within community. She was a principal who worked at a school that served teenage mothers. And so I've always been kind of in a birth worker mindset and frame. Growing up, I spent a lot of time at that school doing like random things that she wanted me to do, um, doing a lot of community service. So when I found out what public health was, it's like I've already been doing all this. Passing out sexual health pamphlets, yeah, I do that. I've been doing that since I was 5. Just talking about what it means to be healthy. My mom does that every day. So public health to me and community was just something that came naturally to me. Um, and I feel like that because I was entrenched in community at a very young age, everything that has followed has always just been about community for me. Um, so yeah,
I appreciate that perspective, and I'm glad that you do have that perspective in doing this work because I think that it is very essential.
yeah, it is.